Hello, everyone. I'm Veronica Solomon, physical therapist, and I am clinician, but also lecturer at the University of Rome, Tor Vergata. And we are very happy with colleagues to present you the results of our research, and the paper will be published soon in POGP in autumn. So let me share with you my presentation and let me share with you all of the results. To contract or not to contract, should we use pelvic floor muscle exercises in the treatment of dyspareunia? So this clinical commentary that we wrote with Julie Bond and with Małgorzata Starzec-Proserpio is very, very interesting. We found it very interesting, and let me present you something more about this paper, and let me present some details about it. So pelvic floor physiotherapy incorporates various pelvic floor muscle training and exercises, widely used to treat diverse pelvic health conditions in both women and men. They have become an integral part of conservative treatment for conditions such as urinary incontinence, fetal incontinence, erectile dysfunction, but also pelvic organ problems. However, there is considerable current discussion regarding the adoption of pelvic floor muscle exercises, which means various tasks involving contraction and relaxation of pelvic floor muscles, such as repeated contractions or hold contractions, for pelvic pain conditions, specifically dyspareunia. This perspective is based on the premise that the underlying pain mechanism is muscle tension, and that contracting muscles further increase the tension which is already present. In other body regions, the paradigm for treating pain conditions has shifted from rest to maintaining activity. Exercises that were once deemed harmful, such as deadlifts or squats for low back pain, are now often recommended. So while recent evidence supports activity and exercise interventions for various persistent musculoskeletal pain conditions, we see contrary messages in pain in pelvic floor area, such as dyspareunia. The main focus is relaxation and down training, and activities involving pelvic floor muscle contractions are often strictly discouraged. Actually, we believed there was more nuance into that, and this prompted us to pose a question. Can strategies incorporating principles of exercise and tissue loading from other musculoskeletal pain conditions can be applied to pelvic health, and more specifically, dyspareunia? Currently, there is a lack of consensus in the literature regarding the implementation of pelvic floor muscle exercises in this condition. We thought it was therefore crucial to determine whether there is any rationale to use pelvic floor muscle exercises in the treatment of dyspareunia. And if so, how interventions that incorporate pelvic floor muscle exercises can be effectively and safely applied. Our work aimed to gather the available body of evidence to report and discuss the following questions. What is the rationale for pelvic floor exercises in dyspareunia? What are the documented side effects, if any? What are the outcomes following pelvic floor muscle exercises in different conditions related to dyspareunia? We have conducted extensive literature research and located data suggesting many potential benefits of pelvic floor muscle exercises in dyspareunia beyond strengthening. And that included reduction of pelvic floor muscle tone, improved contractility and relaxation, enhanced strength and endurance, preventing further overload, and this potential increase of tension, better blood flow and vaginal mucosal tissue condition and elasticity. Additionally, we found some hypotheses suggesting that pelvic floor muscle exercises can contribute to an improved awareness and motor acuity of the region. And you may wonder, that sounds nice, but has anyone actually tried before implementing interventions that incorporate pelvic floor muscle exercises in the treatment of conditions related to dyspareunia? In our paper, we present data from many different research studies where pelvic floor muscle exercises were proposed to women with postpartum dyspareunia or dyspareunia during menopause, such as genitourinary syndrome of menopause, cancer survivors, or women with vulvodynia. All found positive outcomes and non-reported side effects. Analyzing the exercises protocols in the included studies, we found several elements that may help us successfully implement pelvic floor muscle exercises in the treatment of dyspareunia. Most studies use pelvic floor muscle exercises as a part of multimodal physiotherapy interventions, although there were studies using only exercises and those showed benefits too. We may play with a variety of different exercises. Pelvic floor muscle exercises are often associated with traditional Kegels, involving numerous repeated contractions and sustained holds aimed at increasing stiffness, including muscle hypertrophy, so improving muscle bulk and enhancing strength. However, pelvic floor muscle exercises may take different forms and do serve various purposes, including strengthening, endurance, proprioceptive awareness, and functional control. It is not about an all or nothing approach. Pelvic floor muscle exercises may be gradually introduced and steadily progressed to allow for adoption and avoid any undesirable effects. Most programs included physiotherapist supervision, at least at the beginning, to verify the correct execution of pelvic floor muscle exercises. Instructions to participants involve focus on correct technique and execution of exercises such as correct relaxation after each contraction or coordination with breathing. Manual stretching or some form of stretching exercises were sometimes implemented as a part of exercise regimen. So take a home message. So to summarize, should we now prescribe 100 Kegels per day to all our dyspareunia patients? Of course not. Clinicians should tailor treatments to meet the specific needs of each patient, and pelvic floor muscle exercises involving repeated contractions may not be a treatment of choice for each individual presenting with dyspareunia. However, as shown in our article, pelvic floor muscle exercises are a versatile tool which benefits extend beyond mere strengthening. Our work highlights the practical value of pelvic floor muscle exercises in the multimodal physiotherapy treatment of dyspareunia, providing examples on how this intervention is delivered in the available research studies. The evidence does not state that pelvic floor muscle exercises should be used while treating dyspareunia, but they may be helpful, and they don't appear to create adverse events when supervised. We therefore encourage clinicians to be mindful when making generalized statements, especially on social media, discouraging pelvic floor muscle exercises in conditions related to dyspareunia. as they may overlook nuance points within the literature and eliminate a potential beneficial intervention. Thank you very much, and thank you for your interest.